Hello, my name is Celia Ivery, and I will be discussing today PCOS, Polycystic Ovarian Syndrome. What is PCOS? So PCOS is a common endocrine disorder of women of the childbearing age. It affects the reproductive organs such as the ovaries. It is one of the leading causes of infertility. Infertility can be defined as trying to conceive a baby for greater than 12 months or greater. PCOS affects all women of different races and ethnicities, such as African American women, Hispanic, Caucasian, and Asian. PCOS can be defined by three characteristics: elevated androgen levels, which are hormones classified as testosterone, irregular ovulation or lack thereof ovulation, and polycystic ovaries on a vaginal ultrasound. PCOS is also associated with three metabolic dysfunctions. Number one, insulin resistance or hyperinsulinemia. Number two, obesity, which is classified as a body mass index greater than 30. And number three is dyslipidemia, which is classified as cholesterol or lipids at an increased rate in the blood. PCOS does not discriminate against any woman. It affects all women that are short, fat, tall, skinny, thin, as well as obese. Here in the picture, we have a picture here of a normal versus abnormal uterus. In the normal ovary, there are small follicles. In the abnormal ovary, there are many follicles that have not developed due to lack of ovulation. Pathophysiology of PCOS. The exact cause of PCOS is unknown. Researchers believe that PCOS is strongly genetically related. So if a woman has a family history of PCOS, then it is highly probable that the woman will develop this syndrome. There are two hallmark signs of PCOS: elevated androgens, which are testosterone hormones, and insulin resistance and hyperinsulinemia, which is marked by an elevated level of insulin in the blood or in the body. So the insulin in PCOS stimulates the androgen secretions by the ovarian stroma. The ovarian stroma decreases the sex hormone binding globulin and increases the free testosterone. The leptin levels are elevated in the hypothalamus. The follicular stimulating hormones are high, and the luteinizing hormones, the follicular stimulating hormones are low, and the luteinizing hormones are high. The elevated luteinizing hormones increases the DHEAs, which are androgens, from the adrenal glands and the ovaries. The excessive androgens are converted to estrogen in the peripheral tissues, which in turn turns into free levels of estradiol. The elevated levels of estrogen triggers a positive feedback response to the luteinizing hormone and a negative feedback response to the follicular stimulating hormone. So what happens is the cycle keeps repeating, causing a dysfunctional ovarian follicle or an egg that tries to develop during ovulation. But because of the cycle being dysfunctional, the egg never develops and it just keeps repeating the cycle, which you wind up with many cysts in the ovaries. Some clinical manifestations of PCOS are secondary amenorrhea, which is characterized by having menstrual cycles with periods of irregular menstrual cycles. 60% of women experience visceral obesity. So that's characterized as having obesity around the abdominal region, which also you can have peripheral obesity. Insulin resistance. Acne can be classified as painful cystic acne on the face. Hirsutism, which is excessive body hair growth. Usually women will experience hair growth on their face. Some will complain of having a mustache. Some will have increased body hair growth on their legs, on their abdomen. And the most common is infertility, which is infertility has been defined as trying to conceive a baby 12 months or greater with no results. They can also experience male pattern baldness, which is thinning of the hair on your head, and increased levels of fatigue. So this chart just shows that there are the polycystic ovarian syndrome symptoms. So as we pointed out or talked about earlier, the trouble with conceiving or infertility. They also have mood changes, so they'll have mood swings. They'll be okay, and then they'll have marked periods of where they're feeling down, feeling low, especially about body image. They'll have the painful cystic acne on their face, fatigue, anything that wears them out, insulin resistance, high levels of testosterone, which is the androgens, male pattern baldness or the thinning of the hair, irregular or missed periods marked as the amenorrhea. So they may have some cycles and then they may skip a month and then they may have 2 months of regular cycles and then they will have irregular cycles behind that. So the cycle just keeps repeating. They will experience a low sex drive. The ovarian cysts will be marked on or confirmed by the transvaginal ultrasound, and you'll see the little mini cysts that will be in the ovaries. They will have trouble with losing weight or weight changes. And then they will have the excessive body hair growth, which we characterize as the hirsutism. So the diagnosis for PCOS, so it's usually diagnosed by an endocrinologist or a gynecologist. It's usually, of course, one of the hallmark signs is it's marked by excessive androgen levels, chronic anovulation, which is or lack thereof ovulation, so your body never ovulates. Polycystic ovaries on a transvaginal ultrasound. So you must have at least 2 of the 3 criteria to be diagnosed with polycystic ovarian syndrome. We also check hemoglobin A1C levels, which is a diagnosis for type 2 diabetes. You don't have to have diabetes to have PCOS, but diabetes is a very high risk factor for PCOS. And we also check the levels of your follicular stimulating hormone, your luteinizing hormone, and the sex hormone binding globulins. So according to research, some statistics for PCOS are 60% of women with PCOS are obese, and that's characterized as having the body mass index greater than 30 and usually having truncal obesity. Women with PCOS are 3 times likely to have insulin resistance, and 30% of women with obesity develop type 2 diabetes, with or without. Okay? 70% of women with PCOS have infertility. So that is one of the biggest symptoms, is women complain of having infertility, trying to get pregnant or trying to conceive and having issues. 80% of women with normal ovaries experience 1 or more symptoms of PCOS. Losing 10 pounds can restore ovulation and increase insulin sensitivity by 71%. So some risk factors for PCOS are type 2 diabetes, as we talked about. It's characterized by the insulin resistance. So if a woman does actually conceive or becomes pregnant, she may develop gestational diabetes from the PCOS. Pregnant women can also experience preterm births or pregnancy-induced hypertension. Women with PCOS are 3 times greater of having uterine cancers and endometrial cancers related to the excessive estrogen and testosterone circulating in their body. So typically women that have higher levels of estrogen will need progesterone to counteract the effect, so to prevent endometrial cancer. And women with PCOS also have a higher risk of having a myocardial infarction, commonly known as a heart attack, related to the high levels of dyslipidemia in the blood. So some treatment options for PCOS. So number 1, there is no cure for PCOS. Okay, so the goal is to treat and reverse the symptoms, metabolic and endocrine systems, such as the obesity, the hyperinsulinemia, insulin resistance, and the obesity. Losing weight and exercising is the biggest. So women should experience, or women should try to participate in exercises, high intensity exercises, 4 to 5 times a week, at least 30 minutes to an hour each day. So some oral medications that can treat PCOS is an oral combination of birth control with a metformin. Also, progesterone will treat the PCOS. Changing modifiable risk factors. So that would be related to the diet. So no sugars and no simple carbohydrates. So the sugars will increase your insulin levels and your glucose levels, which would therefore increase your insulin levels. Some women that are trying to conceive try metformin and Clomid. These options have been shown to increase fertility. Some alternative supplements I have heard about is alternative supplements that I've heard about: fish oil and DIM supplements. And women also try in vitro fertilization. There again, exercise is one of the golden rules for PCOS. So, a case study, Miss LJ is a 30-year-old female who just recently married 8 months ago. She is 5'3" and weighs 220 pounds. She presents to her gynecologist office today and reports that she and her husband have been trying to conceive, but has been unsuccessful for the last 4 months. She reports only having 2 menstrual cycles over 4 months and gaining 30 pounds since getting married. She also reports to have an increase in fatigue and thinning out of her hair. As the nurse practitioner, you are seeing Mrs. Jackson in the GYN office today. What diagnosis do you suspect? What diagnostic tests do you order to confirm your diagnosis? What treatments and lifestyle modifications do you prescribe for Mrs. LJ? So looking at the case study, so Miss LJ would be diagnosed with PCOS. As the nurse practitioner, you would also want to do a thorough H&P. You would want to find out about her secondary amenorrhea, how inconsistent her cycles have been. You would order a transvaginal ultrasound. You would want to check her androgens and her free testosterone, as well as her estrogen levels. Also, we would want to monitor her blood glucose, so we would check her hemoglobin A1C. The biggest thing that you would tell Miss LJ is that she would need to lose weight and exercise. So as we saw in previous slide, that just losing 10 pounds can increase her fertility and increase her ovulation and decrease her insulin resistance. You would also want to tell Mrs. LJ to eat a balanced diet full of fruits, veggies, and cruciferous vegetables, to stay away and avoid no sugars and no simple carbohydrates. And as a medication, we could prescribe metformin, 1,000 milligrams, PO, BID, since metformin has been shown to increase fertility. So with increasing the fertility and the metformin both together with her losing weight, Miss LJ hopefully should be able to conceive a baby. These are the references that I have used throughout the PowerPoint. Thank you and have a great day.